Well, John, we're more than halfway into budget debate down here at Province House, and I think at this point it's safe to say this budget doesn't have very many surprises in it.
No, we're decades away from when John Hamm, when he was Premier, suggested the opposition ferret out the bad news in his budget. Well, what we've seen with Tim Houston is that he puts it right out there. In fact, two new tax measures in this budget, both aimed at non-residents. He and his minister have been more than happy to be front and center and saying, this is why we're doing it, and we hope it'll make the housing situation a lot better.
Yeah, it's very much a continuation of what we heard from them during the election campaign and in their early days in office. We've also seen them in office long enough now that we're getting a sense of the way that they govern. And, you know, one of the criticisms of the previous Liberal government was that they were often very inflexible, unwilling to change their mind and pivot at times. We've seen a little bit more of that from Tim Houston, most notably earlier this week.
Absolutely. You talked to the Minister of Labour, and she suggested that they weren't ready to move on reinstating sick leave for Nova Scotians. And then 2 days later, the Premier announces that we're going to have sick leave extended to the month of May. So there's some flexibility on that front, but when it comes to COVID, no flexibility. We've seen none to date on reinstituting restrictions.
Our province has done well at the various stages of the pandemic by respecting public health, by listening to public health. We're continuing to do that, but a person's life is complex. You know, their ability to interact in their own social circle, their own mental health. So there's none of these are easy decisions, and to find that balance is something that we're some would say struggling to find the balance. And but I would assure Nova Scotians that we are committed to their health and safety.
Well, and this is a very interesting thing to me because, of course, this is the government that got elected on a promise to fix healthcare, not improve it, but fix it. And I think it's fair to say that at this point in their mandate, they probably hoped that they could have some bigger wins to point to, cutting into surgery backlogs, perhaps, getting more people attached to doctors. But all of this has really been derailed by this explosion of COVID here in the province in the last couple of weeks. And so it's a surprise to me then, in light of that when presented with all of this evidence and calls from a lot of notable medical professionals to at least bring back the mask mandate, so far the Premier is holding firm that he will not do that, and he's going to trust people to do things the right way for themselves.
Mike, we know that this sitting is winding down. In fact, if it hadn't been for the Easter break, we'd be ending a lot sooner than that. But we'll be mopping up probably next week. What we don't know is what COVID will continue to do to the healthcare system, and more importantly for this government politically, what it will do to its plans to improve healthcare.